What's up, everyone? So I just want to take the time to break down a little bit of knee stuff in regards to mobility. So this is kind of for anybody that doesn't have a whole hour to spend in the Kinstretch class. So I'm just going to kind of break this down to a mobility snack. So the first thing we'll go over is an assessment of your knee. And how I like to assess the knee is first kind of have that foot flat on the ground there. First of all, you probably should have already done your cars, so if you didn't, go ahead and check that video, do your cars, and then come back to this video. So first thing I want to do is bring my foot all the way into dorsiflexion. Kind of already have the front of the shin here talking to me. Now I'm going to look from the knee down. Believe it or not, what happens with most people that I assess and I see, they don't realize that your knee is supposed to rotate in and out, or your tibia is supposed to rotate externally and internally. So what I kind of want you to check, we're going to go ahead and, for this video, we're going to work on external rotation, and then I'll make another video for internal rotation. But I want you to assess. I want to see how far you can externally rotate, and then kind of driving your heel into your butt, seeing how far you can internally rotate before that ankle starts to take over. All right? So my favorite way that I found the most success for working on external rotation, pails and rails, and that's just kind of, it's basically we're trying to create more workspace within the joint. So here's my end range external. I'm going to try to give myself a little bit more today. All right, so first thing I'm going to do is I'm going to actively externally rotate as far as I can go. Then I like to grab that inside of that, like your midfoot there. Then what I'm going to do is I'm going to take this opposite hand. In my case, I'm using my right leg. My right arm is grabbing that inside foot, and I'm going to take that left leg, or that left arm behind the right arm, and I'm going to grab around my forearm. Now what I'm going to do here is I'm going to try to see if I can passively get in a little bit more range there, because usually there's a discrepancy. We usually have a little bit more passive than we do active. And now what I'm going to do here is I'm just going to breathe. All right, so I want you to think slow breath in, slower breath out, maybe 3 seconds in, 6 seconds out, or 4 seconds in, 8 seconds out. What we're gonna do is we're gonna sit here. I'm gonna set my timer. Usually I want you to sit for about 2 minutes, okay? For this video's sake, I don't think I'm gonna actually stay the whole 2 minutes. I'm gonna run through it, kind of show you what needs to be done. Now, I want you to imagine that that 2 minutes is now, if you need to pause the video or whatever for the 2 minutes to go by, go ahead and do that. I want you to imagine that the 2 minutes is passed, all right? So what we're gonna do first is, for the pails portion, or progressive portion, I want you to imagine you're trying to rotate that knee back internally, and your hand is gonna not allow that, okay? But I want you to set the intent that you're trying to rotate the shin. And the rails portion is, and what's gonna happen actually, sorry, if the pails portion, you're gonna try to internally rotate, set the intent, but your hand is gonna be blocking that. It's not gonna allow that to happen, okay? And the rails portion immediately after, nothing's necessarily gonna happen or look fancy or anything like that, but you're gonna set the intent. Instead of trying to internally rotate, you're gonna try to continue and drive more external rotation. So you should feel different stuff talking when you go ahead and do it that way, okay? So, take a breath in. Let's do it together. Irradiate, and if you don't know what irradiation is, go ahead and take a look at that video. I'm assuming you did, so I want you to squeeze all your muscles nice and tight here. Now, I want you to think that we're on a volume, we're heading our way to 100% volume here, and right now I want you to turn up that volume to 20, okay? But I don't want you to skip a beat. Don't miss 1, don't miss 2, don't miss 3, all the way until you get to 20. We're gonna start to build up tension here. Now I want you to turn up that volume to 40, okay? So let's start to internally rotate just a little bit more. I want you to work your way to 60 right now. Turn up that volume. Ooh, yeah. Should be feeling real nice and fun right now. Let's make sure the rest of that body is at 60 as well. Build up and work your way to 80. Turn up that volume to 80. A little bit more pressure there. Now your safest, but your greatest 100% max effort trying to rotate against that hand. The hand says no, doing your best, getting all that shin stuff to talk to you. The rest of your body is matching that 100%. I want you to hold that for 5 more seconds. I want you to hold that for 4 more seconds. I want you to hold that for 3, hold that for 2, Now, instead of internally rotate, you're trying to externally rotate a little bit more. My hand relaxes and I'm trying to rotate that foot off of my hand. Rotate and squeeze opposite stuff. So instead of the inside stuff, I feel that outside shin stuff. Hold that for 5, hold that for 4, hold that for 3, hold that for 2. Now I want you to slowly relax and see if your body allows you a little bit more passive range there. In this case, mine gave me like a millimeter, which is a lot. I mean, hey, we're just trying to get some conversation here. We're trying to get you some more workspace. Now what I'm gonna do here, slow breath in. Slower breath out. And we're gonna relax here for about another minute. Then what we're gonna do is you're gonna do it one more time. And then after you finish that second time, actually we'll do that together here. And we're just gonna kind of get some recovery breaths in there and you'll do some strength training, okay? All right, I'm gonna imagine that 1 minute has passed by. And I'm gonna go ahead and do it one more time. Take a nice breath in. Create some pressure in your abs there. Start to squeeze the rest of your muscles here and start to actively internally rotate. So trying to rotate the foot in, but trying to make sure it's coming from that knee stuff, the stuff that we have on stretch, right below the knee, that whole shin bone. Build up to 20%. Sorry, turn up that volume to 40. I want you to turn up the volume to 60 and make sure the rest of that body matches that same 60. Woo-hoo-hoo. And trust me, if you smile through this, I bet you'll get so many more gains. Work your way to 80. Now give me your safest, greatest, max effort. Now mind you, you're a little bit deeper in the stretch if your body gave it to you, so you're not as strong, okay? So squeeze and breathe everything you can. Whole body's nice and tight, driving that knee down, squeezing and trying to drive this foot. You can't tell, but I'm really doing my best to try to pull against this hand here. The hand's stopping it. Hold that for 5 more seconds. Woo-hoo-hoo. 4 more seconds, this is fun. 3, 2, now. Rails effort or regressive stuff, trying to get more workspace, pulling that, trying my best to pull that foot off of that hand, using that knee stuff, opposite side stuff. So you should feel this stuff talking a lot more now. Squeeze and hold that for 5. If you want to use your hand to try to push that foot away from you for 4 to give it a little bit more tension. 3, 2, slowly relax. See if your body grants you a little bit more space here. Now here's all I want from you is 3 recovery breaths here. Go ahead and give that nice strong 3 recovery breaths, and then I want you to check in with the knee car. And if you don't know what a knee car is, again, you should did the cars video before this, so you know what a knee car is, and see how that feels, all right? So go ahead and give that a try. Let me know what you think. Thank you so much for watching, and hope this helps you get these knee gains. Because again, a lot of the times, I see people don't know how to rotate their knee, nor do they even know that it's supposed to rotate, okay? So for the record, it's supposed to rotate. Have a great day.